Hi my beautiful people, hi my good people. You're once again welcome to my channel. Thank you for those who have subscribed. Thank you for your insightful comments. Thank you for liking the previous video. And today I want us to talk about the remedies of or how you can manage nocturnal enuresis, that is bedwetting in other words. So in the previous video, we looked at the causes of nocturnal enuresis. We looked at what is likely to cause this disease, the risk factors, and like what are the symptoms of bedwetting. So as I promised, I want us to look at now the remedies or how can we manage this condition. So but before that, I want to talk about something. So when I was a child, I used to bedwet, okay? I used to have this condition. So in case you're feeling like, oh my God, what is happening to me? What did I do? Do I have some problem? No, you're not alone, my darling. You're not alone in that. Like, it's okay. You'll be fine. And one day I know you'll just come out and tell the world what used to happen and what you did to overcome it. So I'm going to give you step-by-step remedies and you can try it. So when I used to sleep, you sleep in a very comfortable environment. The pillows, the bedding is very warm. And then you wake up maybe at midnight, boom, it's cold. The pillows are wet, they are cold, and you're like, oh my God, what did I do? You feel embarrassed. At some point you wake up, you don't want to show the wet pillows, the wet sheets, because somebody is gonna laugh at you and people will be like, oh my God, look at her, she's bedwetting. It's so embarrassing. At some point, by the way, the self-esteem, like, it went down completely. So I'm like, how do I even stand in front of my friends with this condition? But don't worry, I want to show you what we're gonna do so that you can go through it. Also, you find like you have some friends, they mock you, they do this and this, your peers in school. At some point, they laugh and gang against you. They're like, there's nothing you can tell us, and you're bedwetting. Having this condition, it's not somebody's liking. Sometimes it's something that is involuntary. So as a parent, as a friend, as a sister, as a brother, you have to understand that this is something they don't do out of will. So what are we going to do to get rid of this condition? One, limit the intake of fluids in the evening. So I really thank my parents because they were supportive at this point. At some point it used to make me feel bad, but when it comes to like past 6 or past 5, there is no intake of any fluid. And if they're like, I want to drink, they're like, okay, don't forget. And you're like, okay, it's fine. So you can take something you like. Maybe you like to take milk, a glass of milk. You're limited to that, and that really helped a lot, because if you take lots of fluids at night, it means that you'll have to wake up at night to pee, and if you don't wake up, that is it, you'll do that thing again. Also, you have to manage the underlying conditions. If you have UTIs, if you have kidney failure, if you have hormonal imbalance, you have to do that. And to manage those conditions, you have to visit a medical practitioner. You have to get some drugs so that you can help to regulate that condition. You need to seek also help or medical help from professional psychologists and therapists, just in case you're undergoing emotional stress or psychological issues, because they can help you. Maybe you have issues at work, it's so stressful, you are moving to a new place, so at some point that can make you also have bedwetting issues. And also, by the way, as a result of bedwetting, I realized that alone can also give you stress, like how I did it again. Oh, I promised I'll not do it again, and again you were there. So at some point it also makes you stress. It's stress on top of another stress. Let me tell you, it really affected me so much. So you have to seek medical help. You need to seek help from the professional therapist, so that they can guide you through, you manage the stress and overcome it. Maybe your exams, you're struggling, you're anxious, you have to look for medical help. Also, you have to go to the bathroom before bedtime. That will also help you to empty the bladder before you go to sleep, because you are going to have a less volume of urine. So in as much as urine is going to be produced in the body, it will also help you to manage. There will not be a lot of it as before. You need to do urine therapy during the day, like pee regularly or train your urine. Okay, I'll be peeing at this after these intervals, after these intervals, so you get that the body system gets adapted to that, and you'll wake up, or you like, when the body system gets used to that, it's very rare for you to have that condition. Also, you need to you need to set alarms at night. Like, you need to try to wake up at night so that you can pee. If you're a parent, or if you're a sibling, if you're a friend, and you know the child is bedwetting or somebody is bedwetting next to you, you can give them some intervals of like 3 to 4 hours at night, so that they can wake up and release the pee. That will help them also to train them. If that happens regularly, you'll find that this child or this person, after some point, they get used to that. You know, when we talk about behavioral management, you'll find that they're used to that after some time. Now, I want to talk about something like, okay, you've tried to manage that, maybe it's not working, but okay, before it has not started working, what are you supposed to do if you're having this condition? One, you need to wear absorbent pants. So most, if you look at children, we normally give them, we put the diapers on them, so that if the pee comes, it doesn't wet the bed. Also, as an adult or as a teenager, you need to get those absorbent pants, so that you don't soak the mattress, you don't soak the bedding, or you don't soak the sheets, because sometimes it's embarrassing to take them out to dry. It's embarrassing to be washing them every day. Or in some cases, I saw some parents in schools, especially in boarding schools, they have these heavy covering. I don't know, it's nylon, it's called a Macintosh. So it's like a covering that it's waterproof. So if you pee, like, this urine doesn't get into the mattress. So if we are gonna wash anything, you're just going to wash the bed sheet, and that is it. So that is also going to help this person. So I don't know what happened, but you can drop your comment there. When it was cold, there are very high chances of bedwetting. I want to link it to this hormone we call ADH hormone, that is antidiuretic hormone. And this is the hormone that is responsible for regulating the amount of urine that is absorbed in the kidney. So you find that if less urine is absorbed into the bloodstream, and remember, it's cold, so the body doesn't need a lot of water, so you find that a lot of water is released from the bladder. So that means that, and if you find the rate at which somebody pees when it's cold, it's very high. So you find that when it's cold, people tend to have this bedwetting issue. So back to my point, I want to talk about, also, you make sure that the bathroom is available, okay, or the washroom is available, so that this person will wake up at night. They don't need to be scared, or like they need something that will help them to release themselves at night. I don't know what to talk about African countries, because at times, it's dark outside, and most of the bathrooms are outside, so it can be sometimes hairsome. And I want to talk about now, generally, to friends, to peers, to mates, to schoolmates, to parents, friends, siblings. Avoid body shaming. Avoid shaming these people. If somebody bedwets, okay, it's okay. Talk to them positively. They're gonna come through it, because when you shame them, these people will have they have low self-esteem. They feel like they are not equal to it. Oh, what are you talking about? And you're bedwetting, or it's gonna rain, or it's not good. So try to support these people, be there for them emotionally, support them, help them to go through it, and they should get help them get medical help, and it shall be well. So thank you for watching the video. You can also type your comment there, what you think is gonna do, or what happened to you, what helped you to overcome this condition. Thank you.